Good morning, ladies. How are you?
Good.
Good, how are you?
Fine. I'd like you to introduce yourselves and tell us a little bit about where you're from and what your job here at HCIS, the clinic at Compton, is. Please.
Okay. Do you want to start?
My name is Taylor. I am originally from the Bay Area of Northern California, and I moved down here to go to college. And now I'm currently an MPH student at Charles Drew University, graduating this June with my master's in public health. And so I started this practicum here at Centennial High School with Healthcare Integrated Services as an intern over the last year.
Great. Thank you.
My name is Cassandra Bonney. I'm also a master's student at Charles Drew University, getting my master's in public health. This option, or healthcare integrated services, became an internship option for us, and I said it's in the community where I get to help the youth in underserved communities. So I gave it a shot and got good results out of it. I've been doing my practicum as well as Taylor for well over about a year now. And from there, we've learned a lot about the community, the needs that the kids need within this community, and how there's such a big deficit when it comes to accessing services. A lot of these kids themselves didn't even know that this clinic existed on their school campus.
How did you rectify that then?
Just doing a lot of outreach within the students. Whenever like the passing periods would occur, we'd say, "Hey, do you need any kind of health services? Here's the clinic. Come check us out."
Okay.
And so once they came in for like physicals or the basic screenings, then they made it a point to keep coming.
That's wonderful. And tell me, from a personal perspective, what did you gain from this experience?
For me, one of the things that I gained was how integrated, I guess, everything is in terms of your health, right? So one of the things that the first stood out to me about Centennial when I came here is just all the ways that, as Cassie mentioned, that the lack of access, but it's not just lack of health access, it's just lack of access with having a safe school campus, or having access to quality education, or having access to these sort of resources that I had when I was in high school, and coming here and seeing that they don't have that, and then how much that compares to just overall well-being and overall health, and how they handle trauma, or how they handle pressure, peer pressure, or stress from their parents, or whatever it is. You see how that all kind of becomes a melting pot, and it all just contributes to their health outcome being less than satisfactory, and their quality of life decreasing. And so I think that's one of the major things that I've learned here is I came here wanting to have a clinic experience for adolescent youth, and seeing sort of how we cater our healthcare services to take care of the needs for adolescents. And I was just mind blown by how much everything sort of compiles into one another and becomes this huge problem, and how this basically how this clinic not only is setting out to provide good health care and like access to physicals or whatever pregnancy tests, but also just sort of providing sort of structure and providing just consistency that is lacking in other areas of their own life, and how that even can be a form of a protective health measure, just having consistency or structure in their lives.
And
For me, what I've gained out of this is that it's very important to have a safe space for these kids, given their community. And even just having a safe space opens up topics for conversation. A lot of these kids come in just for clinical services, and they didn't even know that we have a behavioral intervention program, that we have a peer counselor program, and that we now have the medical assistant apprenticeship program. And we would have never known that any of these kids were interested in any of those if we didn't start a basic conversation.
okay, so let me ask you this though. There are clinics on the outside that are going into the quote unquote community. How is this different than the clinics that you see on the corners outside of here?
I feel like because we're stationary, it's consistent, and it's more of a welcoming space, because they know like at any time they could come to us. And it's not one of those where it's like, okay, well, I have to go to an outsourced clinic, they might not be here today, or they're not here on a routinely basis.
And they know you. I've seen that. The kids know you, which helps. Which if you go sometimes to an out clinic, you don't get that. It's rotating through.
Yeah. And I think one of the things too that I've also noticed with the difference between this clinic and other clinics is that a lot of times when community clinics go into a community or into a neighborhood, they look at health statistics, and they look at, oh, this community really has this problem with diabetes, so we're going to focus on diabetes or something. But it's the clinic is focusing on their own understanding of what the community needs, and they're using that to apply their healthcare services. Whereas here at this clinic, Dr. Miller and the staff here have really made it a point to understand what the kids need first. And so, for instance, when we did with our peer counseling program, is we asked them, we said, what are the health topics that you think are most important? And
Was
then
it different? I
structured-
mean, hate to interrupt. Was it different than what you thought it would be? or not?
Some areas were, and some areas were not. So, for instance, we know that we assumed that drinking and drugs was going to be one of the top things, or that STDs and like pregnancy related topics was going to be important. But then one of the things that I think surprised me was people. What was one of the students that said? Oh, lack of respect.
From
Was
the
one of the
teachers.
students that they brought up, and I was really surprised by that.
That's
something.
very surprising.
It
Yeah.
was lack of respect and
Probably
lack
from school teachers and on the outside.
Right.
Yeah.
Right?
And they also said there is a lack of infrastructure within the school.
Yeah.
And so, yeah, a lot of them felt like either they weren't safe on school or the teachers weren't really there to teach or protect them.
And that's not something that generally you look at as a health concern, right? But we learned that
It is
through
that
them,
way,
and we
yeah.
structured our program based off of their needs and their things that they valued.
Wow. You've given us a lot to think about. And I appreciate it. I know from just watching the interaction, I haven't seen you much, but the interaction I've seen, the kids know you and they see you guys as safe people to come to. And that's worth its weight in gold. So I thank you for that.
You're welcome.
Right.
Yeah, thank you.